Nursing assistant is a certificate program, which means they go to school for 2 years. So note that when it comes to nursing assistant clinical and nursing assistant preventive, for nursing assistant clinical, they work under nurses, general nurses, and then for the nursing assistants preventive, they work under the public health nurses. So most of the times their questions or their things they do is like public health nurses. For the nursing assistants preventive, they are also known as community nurses. They work under the public health nurse. They do things like the public health nurse. Whilst the nursing assistants clinical works under the general nurses, they do their things like the general nurses as well. Okay, I hope you get it. So sometimes we usually use the duties we do for general nurses for the duties we do for the nursing assistant clinical. That's the same way the duties a public health nurse does. The same thing for a community nurse or nursing assistant preventive. Hello, besties. Welcome back to my YouTube channel. If you don't know who I am, hi, I'm Mavis Akest. So thank you so much for rewatching my videos, liking and then sharing. If you're a new subscriber, don't forget to like, comment and share. And if you're an old subscriber, thank you for sticking and staying. So in today's episode, let's talk about some sample interview questions for the NAC and then the NAP. I want to add them together, okay? Just to make it simple, and I don't want to make this video quite long. So do you want to be a NAC or community nurse or public health nurse? Then this video is for you. I would like to share some sample interview questions you might meet when you go for your interview as a nursing assistant clinical or nursing assistant preventive. Yeah, so do want to stick and stay to watch till the end as well. So let's start. First thing, tell me about yourself. So tell me about yourself simply means they want to know your name, your age, the school you completed, and then the program you did. And then you can add some good things about yourself to make it tantalizing. Yes. So those are the basic things you would have to do. You tell them your name, your age, the school you completed, the program, and then if you are kind, compassionate, caring, you add all of them to it. Why do you want to be a nursing assistant? Nursing assistant is a certificate program, which means they go to school for 2 years. Nursing assistant, clinical or preventive, they all go to school for 2 years. But then you want to go there because you want to get some practical skills of caring for a patient before you go to your real program. Yeah. Or you can also say, I enjoy caring for people and I want to start my nursing journey by learning the basic fields through this program. That is why you want to be a nurse assistant. What are some qualities of a nurse assistant? We have the kindness, respectful, patient, good communicator, teamwork. Those are all the qualities of a nursing assistant preventive or nursing assistant clinical. What is your strength? I am calm. I am respectful. I like working with others, but you can also add some strengths to it. What is your weakness? I feel shy in big groups, but I'm learning to become more confident. Yeah, so that I do not see that, hey, girl, we and you don't go don't minimum want to mean kasa. So some roles of a nursing assistant. You help in checking vital signs. You help in assisting nurses. That is for the nursing assistant clinical, okay. They help, they assist nurses, they check vital signs, they keep the environment clean, and then they help patients with daily activities. For the nursing assistant preventive, they educate the community, they assist in immunization, and then they help during outreach. So note that when it comes to nursing assistants clinical and nursing assistants preventive, for nursing assistants clinical, they work under nurses. general nurses. And then for the nursing assistants preventive, they work under the public health nurses. So most of the times, their questions or their things they do is like public health nurses. For the nursing assistants preventive, they are also known as community nurses. They work under the public health nurse. They do things like the public health nurse. Whilst the nursing assistants clinical works under the general nurses, they do their things like the general nurses as well. Okay, I hope you get it. So sometimes we usually use the duties we do for general nurses for the duties we do for the nursing assistant clinical. That's the same way the duties a public health nurse does. The same thing for a community nurse or nursing assistant preventive. And ask a nursing assistants preventive that what is the meaning of immunization, because they do the same thing as a public health nurse. Immunization is giving vaccines to people to prevent them from certain diseases. Nursing assistants preventive that what are some diseases under immunization? We have the measles, tuberculosis, and then polio. What are some things to protect yourself from infections? You have the glove, the goggles, and then even nose masks. Those are for the nursing assistants preventive because they are nurses which work under the public health people. So everything like them is like public health nurses. What is sanitation? Sanitation is keeping our environment clean. What is the meaning of SHIPS? That is the community-based health planning and services. For the NAC, since you are under the general nurses, you can be asked, what is personal hygiene? Personal hygiene is keeping your body clean to prevent illnesses. You can also be asked, mention 3 vital signs. The 3 vital signs can be temperature, pulse, and then respiration. You can also be asked, how do you take the temperature? By the use of a thermometer. How do you communicate with a patient who doesn't speak your language? You can use sign languages, or you can get somebody to interpret it for you. Another thing can be, how does infection prevention means to you? Infection prevention means a step by stopping the spread of germs in the hospital. And what are some ways to prevent the infection? By washing your hands and then wearing gloves, nose masks, and nursing assistant clinical. You can also be asked, what is first aid? First aid is immediate care given to a person who is injured before the medical help arrives. And then for the community nurses, can be asked, why is it important to teach people hand washing? To prevent the spread of infections and then germs and sicknesses. Can also be asked, what is malaria and how do you prevent malaria? Mention 2 causes of diarrhea. What is personal hygiene? Mention some 2 personal hygiene practices. What does NMC do? Just like the public health people. Why should we choose you? And then there are more. Please patronize my PDF. 20 CDs for one. And then if you are not a subscriber, 25 CDs for one. If you want 2 for a subscriber, is 35 CDs for a subscriber. And then if you are not, 45 CDs for a non-subscriber. So if this video helped you, don't forget to like, comment, and then share. And do well to DM me if you are interested in the PDF, because my PDF has a lot of information you might need before your interview day. And don't forget to like, comment, and follow me for more. If you don't know who I am, hi, I'm Mavis August. See you in my next episode. Bye. Mwah.